What if you could stop having your Medicare Part B premium taken out of your Social Security check every month? Depending on your income and resources, a Medicare Savings Program may be able to help. And some of these programs can help with even more than just the monthly premium. Hey folks, welcome back to the 65 Brief where we explain Medicare in plain English. This week we are talking about Medicare Savings Programs, what they are, what they may help pay for, and why you shouldn't automatically assume you make too much to qualify. Let's start with what a Medicare Savings Program actually is. Now, a Medicare Savings Program, often referred to as MSP, is a state administered assistance program that helps eligible people with certain Medicare costs. These programs are generally handled through your state Medicaid office, but they are not replacement insurance, Medicare Advantage plans, or Medicare supplement plans. They are financial assistance programs designed for people who meet certain income and resource requirements. Now, the benefit most people are interested in help with is their Medicare Part B premium. For most people, that premium is deducted directly from their Social Security payment each month. Depending on the program you qualify for, the Medicare Savings Program may pay that premium instead. But the help may go on beyond just your Part B premium. Depending on the program, assistance may also include the Part A premium in certain situations, along with Medicare deductibles, coinsurance, and copayments. The important thing to remember is that all four Medicare savings programs do not provide the same level of assistance. Now, there are four Medicare savings programs. You've got QMB, SLMB, QI, and QDWI. And I know those names are definitely a mouthful, so let's go ahead and break them down without getting lost in the alphabet soup. So first, let's talk about QMB. QMB stands for Qualified Medicare Beneficiary, and it generally offers the broadest level of assistance. QMB may help pay the Part A premium when it's applicable, as well as the Part B premium, Medicare-covered deductibles, coinsurance, and copayments. QMB also comes with important billing protection, and we'll discuss that here in a moment. Now, SLMB stands for Specified Low Income Medicare Beneficiary, while QI stands for Qualifying Individual. Both of these programs primarily help pay the Medicare Part B premium. The main difference is the eligibility category and the income limits used for each program. For example, QI funding can be limited, so applications may be handled on a first-come, first-served basis. Now, the fourth program is QDWI, or Qualified Disabled and Working Individuals. This program applies to a much narrower group, so it's generally certain working people with disabilities who lost their premium-free Medicare Part A after they returned to work. QDWI may help pay that Part A premium, Now, let's get back to that important QMB protection. Providers generally cannot bill people enrolled in QMB for Medicare-covered deductibles, coinsurance, or copayments. That means a QMB member should not be balance billed for those Medicare-covered costs, even if the provider does not accept Medicaid. If someone with QMB receives one of those bills, they should not simply assume that the charge is correct. Now, there's also an important prescription drug benefit connected with these programs. Someone who qualifies for a Medicare Savings Program will also qualify for extra help with their Medicare Part D prescription costs. So one eligibility decision may help with both your medical costs and your prescription drug costs. So who should consider applying? If you are someone who's living mainly on Social Security or limited fixed income, if you are someone whose Medicare costs are just putting more and more pressure on the monthly budget, or someone whose income recently dropped, you should definitely at least look into it. It may also be worth checking after the death of a spouse, after major financial change, or even if you've previously applied and been denied. If your circumstances have now changed, then it's definitely worth looking into it again. Now, here's one part I really want to emphasize. Do not automatically assume you make too much to qualify. There are all different types of ways to qualify. Some types of incomes may count. may not count. Some resources may be excluded, and state rules may be more generous than the basic federal guidelines that you found online. Looking at one chart on the internet is not the same thing as receiving an official eligibility decision. Applying is the only way to know for certain. And when you apply, they look at your eligibility, and there's two main areas they generally look at: your monthly income and your countable resources. So monthly income could include things such as, Social Security payments, pension income, wages, and other countable forms of payments. Resources may include bank accounts, investments, and other certain assets, but not everything you own or receive necessarily counts, which is another reason not to self-disqualify. Now, to apply, start by contacting your state Medicaid office and ask specifically for a Medicare Savings Program application. They will generally ask information about your income, your resources, Medicare coverage, your household situation. So just make sure that you provide any documents they request so that they can make an official eligibility decision. Now, if you need help with anything, you can contact your local SHIP program, SHIP program, for free, unbiased assistance. SHIP counselors can help explain the programs and guide you towards the correct application process. And then Medicaid is the one that actually makes the official eligibility decision. And one thing I will tell you, you should not have to pay someone just to help you apply. If you're going in and you're just needing help with applications and things like that, you should not have to pay for it. So to recap, Medicare Savings Programs may help eligible people pay Medicare premiums, and some programs also help with deductibles, coinsurance, and copayments. Qualifying can also provide extra help with your Part D prescription drug costs. And most importantly, and I've said it over and over again, do not assume you are ineligible without applying. If your Medicare costs are putting pressure on your monthly budget, contact your Medicaid office or your local SHIP program and ask to be screened for a Medicare Savings Program. As always, guys, this video is for educational purposes only and is not a guarantee of eligibility or benefits. Rules can vary by state and may change over time, so it is very important that you check with your local state Medicaid office for further verification. This has been another episode of the 65 Brief. Subscribe for clear, plain English Medicare education without the confusion. Thanks, and we'll see you next week.